Good evening. I'm Roberto Santamaria, your host this evening for Nantucket Pulse programming made possible by Nantucket Cottage Hospital Community Health Initiative. This is a special edition of Nantucket Pulse programming that will air weekly, covering the coronavirus impacts for the island, and we will provide urgent updates as they unfold. We will be taking on questions. Please log in to NCTV's Facebook and YouTube pages to post questions, and we will answer as many as we can in the time allowed. Before we begin tonight, I would like to share a statement from a business that plays an important role in our community, Stop & Shop. Given the recent developments concerning the coronavirus, the company issued a statement to NCTV saying, quote, "We recognize the important role Stop & Shop plays in the Nantucket community, and we're committed to doing our very best to support our local customers and associates throughout this busy time. Our top priority is the safety and health of our associates and customers. We continue to actively monitor coronavirus in the U.S. and are following the guidance of global, national, and local health authorities. We have amplified our cleaning and sanitizing efforts to ensure customers can shop with confidence. Upon entering our stores, disinfecting wipes are available near the entrance, and customers are welcome to wipe down carts, hand baskets, and scan-it devices before every use. Our associates are frequently wiping down self-service locations and checkout areas with disinfectant. This includes the belts and pin pads at all our registers. All of our self-service offerings, including our olive bars, wing bars, salad bars, and hot bars, have been suspended. Packaged items will be made available in their place. This also includes pick-your-own bakery items like donuts and muffins, as well as self-service nuts and baking items. However, plenty of pre-packaged options for all of those items will continue to be available. We have also suspended our food sampling programs, in-store events, as well as community solicitation until further notice. Our team is in close contact with suppliers and is working diligently to try to keep high-demand products in stock. We are still operating our regularly product delivery scheduled to the islands." Unquote. And now, we would like to show you the PSA that the Nantucket Cottage Hospital and the Health Department has set up for you. There's been a lot of discussion about a new illness and its impact on the United States. Hi, I am Roberto Santamaria.
And I'm Gary Shaw. This virus is a respiratory illness called novel coronavirus, or COVID-19. This outbreak started in China and has spread to several other countries, including the United States. The novel virus causes respiratory illness and can spread from person to person.
Symptoms of this infection include fever, cough, and shortness of breath. While most people do recover, it has led to serious illnesses up to and including death in some cases.
Nantucket's health community and emergency staff are working hard to protect the residents of our little island. We are asking you to help us by following the same safety precautions we use to prevent cold and flu.
Wash your hands with soap and warm water. Make sure you scrub them thoroughly for at least 20 to 30 seconds, and wash your hands often.
Cover your cough and sneeze correctly every time.
Stay home if you are sick or showing any symptoms.
If you have traveled to any country that has cases and you are showing symptoms, call your healthcare provider and coordinate testing and care.
This is an evolving event, and we are learning more about this virus every day. We will do our best to get information to everyone as this continues to evolve. Stay up to date by visiting our websites and other reputable sources.
Thank you, and be safe.
I'm Gary Shaw, President and CEO of Nantucket Cottage Hospital. I want to assure the community that your hospital and the incredibly dedicated team of staff and clinicians we have here are doing everything they can to prepare for potential cases of coronavirus or COVID-19. While we have not yet had a confirmed case of COVID-19 on Nantucket, island residents should be taking the situation very seriously and taking every precaution we can to prevent any potential spread within our community. In fact, we should be acting as if the virus is already here. We are advising residents, businesses, and organizations to cancel events and gatherings, practice social distancing, work from home if you're able, and take every action that are proven to prevent the spread of respiratory illnesses like COVID-19. Those include avoiding close contact with people who are sick avoiding touching your eyes, your nose, and your mouth with unwashed hands, washing your hands often with soap and water for at least 20 seconds, or using an alcohol-based sanitizer, and staying home if you feel sick. You may have heard the term flatten the curve, and that is certainly our goal. We want to avoid a scenario in which there is a surge of COVID-19 cases that could threaten to overwhelm our island's healthcare resources and providers. To do that, we need everyone in the community to take the precautions I mentioned earlier. The symptoms of COVID-19, including fever, cough, and shortness of breath, are very similar to other seasonal illnesses that are circulating in the community now, like the common cold and flu. If you are experiencing these symptoms and are worried you may have been exposed to COVID-19, before coming to the hospital, please call ahead to the physician practices offices at this number, and please write this down, 508-825-1000, and tell them about your symptoms. You'll be screened and provided instructions. At this time, I urge everyone to stay calm and not panic, but to take this situation seriously and remember to support one another as much as we can. I also encourage all residents to visit our website, nantuckethospital.org, for regular updates and information on this clearly evolving situation. Thank you.
So now, Gary, I have a question for you. With all these things about the hospital, what should a Nantucketer do? What would a Nantucketer do?
Well, first, let me say welcome to the show.
Oh, that's right.
No, we're not shaking hands.
Not shaking hands.
We're looking at all those things that could transmit this disease, and we're saying, let's not do those. So let's just do the elbow wave and say hi. Distance is good. That's what a Nantucketer should do.
Excellent. Okay, so we should make sure that we have enough social distance and that we are not spreading the virus between each other. It's actually really good. So as a result of that, there's been a lot of questions on the island. So one of the questions that keep coming up is the boats going to be canceled next week?
Well, from what we understand, no. The boats are going to continue and should in this environment. But we hope what occurs, and are confident is occurring, is cleaning and protection measures of people on the ships. If you are ill, if you feel that you are sick, don't get on it. Don't come here. Stay home and practice those social distancing things.
Excellent. Excellent. So another question that's been popped up is, what about the bars and the restaurants that are public meeting places, as well as similarly Stop and Shop and post offices and banks? Well, one of the things that we are asking to do is to try to limit your exposure to these groups. The governor of Massachusetts has issued a ban on large gatherings. All gatherings from 250 people or more have been canceled as long as they need, as long as you're paying attention to these rules. As a town, we have also stopped issuing permits for all large gathering purposes. Another rumor report that we've been seeing is, are the schools going to be closed? Well, right now we're looking to discourage the schools from closing, but that is also an evolving situation. Another rumor is that there's not going to be any wipes and toilet paper and things at Stop and Shop. As you saw from our statement, they're working very hard to get all of our things back in stock as soon as possible. So thank you for watching. We will be back next week or sooner with updates on the coronavirus and impacts for Nantucket. We need to be prepared and informed. We need to be prepared and informed and do not panic. And please, during this time, it's crucial to get the facts from your local news sources, such as the Enquirer and Mirror, 97.9 AC-FM radio, and Nantucket Community Television, NCTV, Channel 18. Good night, and I'm Roberto Santamaria, the Health Director for the Island of Nantucket.
I'm Gary Shaw. It's been a pleasure, and if you do have questions, please give us a holler at the hospital. We'd be happy to answer any you might have. Good night.